Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about allopurinol, or Zyloprim. This is a drug that's a xanthine oxidase inhibitor that's used for the treatment of gout and related conditions. It was first put on the market in 1966. And now, over 50 years later, there are still about 15 million prescriptions written every year for this drug. It's not an innocuous drug, and it's not meant for people who just have mild elevation of uric acid without any kind of other symptoms. It's used for the symptoms of gout, for people who have acute gouty attacks, typically involving the big toe, or people who have gouty tophi, uric acid deposits in the skin or the kidneys or the joint, people who have joint destruction from gout, or kidney stones, uric acid stones from gout, or even kidney damage from the gout. And in people who have, or we anticipate they're going to have, a condition known as the Tumor Lysis syndrome. These people have cancer, typically cancer of the blood. So they have leukemia, lymphoma, maybe they have myeloma, or some people just have very severe psoriasis where they have the entire skin turning red. Well, those people, when they begin therapy, they make a lot of uric acid, and that might block the kidneys. So those people prophylactically are treated. However, just because an individual has an elevated level of uric acid doesn't mean the person needs therapy. The drug is also used in people who have calcium oxalate kidney stones. And these people also, in addition to the stones, have elevated levels of uric acid, and it can't be controlled by other means. The kidney stones can't be prevented by other means. Now, if we look at gout itself, it's very common. It's a metabolic disorder that affects somewhere around 8 million people in the United States. It's an increase in uric acid associated with deposition of uric acid as monosodium urate crystals in the tissues of the skin or the joint or the kidneys. Uric acid is overproduced relative to its removal by the kidney. Elevated uric acid levels are a marker for increased mortality, for coronary heart disease, and for kidney failure. We would like the uric acid level in people with gout to be less than 6, and if they have skin deposition of the uric acid, we'd like it even lower, let's say around 5. Now, allopurinol may start to drop the uric acid within several days of beginning therapy, and depending on how much uric acid is stored in the body, you can have a full effect of the drug within a week. But if you have a large store of uric acid, you have those tophi that are in the skin or in the joint or in the kidney, well, then it can take a long time for the uric acid to come back down to normal. If you stop taking the drug, the uric acid goes right back to where it started within about 7 to 10 days. There's a decrease in clearance of uric acid in males, in postmenopausal females. So in other words, women prior to the menopause rarely get gout, rarely have an elevated level of uric acid unless they have some other kind of an abnormality. People who have elevated uric acid typically have metabolic syndrome. Maybe they're taking low-dose aspirin, they drink too much alcohol, or they've been exposed to lead. We know that uric acid crystallizes when it's more than 7 milligrams in the system. That's why we like to keep the level down to less than 6, or even better yet, less than 5. We can reach this level in about half of the people in about 3 months, but it often takes a year or even longer to get to appropriate levels, depending on, again, how much uric acid is stored in the system. Now, even though patients are typically started at 100 milligrams a day, well, unfortunately, oftentimes they're not changed from that 100 milligrams a day, and they're not getting enough. They're not getting enough to give themselves the full benefit. The typical dose is about 300 milligrams. Even that's not enough in a significant number of people. Now there's a tendency to treat to the target. So we go up to 800 milligrams or even 1,500 milligrams if necessary, while the blood tests check the kidney function and other potentials for problem inside the body. Now, traditionally, allopurinol is not started during an acute attack of gout. It's thought to, in some people, precipitate gouty attacks, paradoxically. However, newer information from the American College of Rheumatology says you can start the drug whether you're having an attack or whether you're not having an attack at the time. On the other hand, the British Society of Rheumatology still says you ought to wait for about 4 to 6 weeks until the acute attack has calmed down. Now, people taking allopurinol, well, within several months, they're going to have, if they have attacks at all, they're going to have shorter attacks and less severe attacks. But remember, depending on how much uric acid has been stored, we can have significant fluctuations for a significant period of time, often for months to even years. Now, in the early treatment, we find that a person who starts the allopurinol might actually have a flare even if the uric acid is normal or even less than normal. And as a result, when people start allopurinol, it's typical to begin some sort of prophylactic therapy for several weeks, even to several months. In the old days, like 5 years ago or more, we used to use a drug called colchicine, but colchicine's price has increased horrendously. So now we use nonsteroidal anti-inflammatory drugs, drugs in the family of aspirin, Aleve, or naproxen. Well, typically the allopurinol is begun at a dose of about 100 milligrams a day, and it's increased every week by about 100 milligrams until the uric acid level gets less than 6. Now the question is, if you have an acute attack of gout and you have an elevated uric acid level, does that mean you should take the allopurinol or the Zyloprim? And the answer is, according to the American College of Physicians, this is debatable, but the American College of Physicians says, hey, if you only have a rare attack, an infrequent attack, say up to 1 a year, then maybe the risk-benefit ratio would suggest you don't do anything. On the other hand, if you have 2 or more attacks, then you should discuss the relative merits of taking the drug with your doctor. Well, irrespective, you need to have significant amount of fluid intake so that you make about 2 quarts of urine a day. Especially, we would like the urine not to be acidic. If we have an alkaline urine, that helps prevent the xanthine stones from forming. And in people who are taking additional drugs to help lower the uric acid, we call these drugs uricosuric, that make you urinate a lot of uric acid, well, the combination of an alkaline urine and a lot of urine helps prevent the precipitation of uric acid stones. Now, what's the dose? The dose on average for people who have mild gout might be 200 to 300 milligrams a day, and if you have more severe gout, it might be 400 to 600 milligrams a day. If you're taking the dose of 300 milligrams or less, you can take it all at one time. But if you take a higher dose, then you ought to take it in 2 doses. You ought to divide it in half. We also know that you might have to take a lower dose if you have kidney disease. Now, according to the Annals of Rheumatic Disease, when we look at people who are taking allopurinol, you can take it safely at relatively high doses. If we look at the typical dose and look at about 12 months after the person has been taking the drug, we find that only about 1/3 are going to have the uric acid level less than 6. And 2/3 of the people can have an appropriate level of uric acid if we escalate the dose. Very important. And when we look at people whose dose has been escalated, they don't necessarily have any greater incidence of side effects. So that's a good news. Well, remember that a dose of less than or equal to 300 milligrams might be inadequate. Dose might have to go as high as 800, 900, 1500 milligrams, but you have to monitor especially the kidney function, especially during the first year, the BUN and the creatinine. Very simple to do those kind of tests. Well, interestingly, we find that a higher dose of allopurinol might actually be protective for the kidney, especially in the elderly individuals. So those people who are taking a dose of at least 300 milligrams, well, they have about a 40% decrease in the incidence of kidney failure. So that's pretty good. So how much benefit do we get? Well, in those people who are just taking, say, 100 to 300 milligrams of allopurinol, if we look at 100 people followed for a year, people who have gout will have approximately 12 attacks. if we treat them with the 100 milligram, 300 milligrams of allopurinol, then they'll have about 8 attacks. So in other words, we're going to reduce but not eliminate gout by taking allopurinol. Well, it's also important to realize that some percent of people who take the drug are going to have side effects. On the other hand, the benefits of taking the drug, well, if you take the drug, you can reduce the uric acid and then theoretically improve your long-term health. You can decrease the risk of stroke by about 50%, decrease the risk of cardiovascular events by about 40% in the standard doses, and if you take a higher dose, higher than 300 milligrams, then those numbers are even going to be significantly improved. Now, if you have kidney stones, remember the calcium oxalate stones with a high level of serum uric acid, you're taking the adequate hydration, you made the appropriate dietary adjustments, but you still have a problem, then the dose is much lower. It's only 200 to 300 milligrams a day. Well, people taking the drug need to have their blood test periodically performed, have a uric acid level both in the blood and in the urine, have kidney function tests, blood count, red count, white count, check the liver, make sure it's working well, check the thyroid, and special caution in those people who might have kidney problems because maybe of diabetes or high blood pressure. American College of Rheumatology recommends less than 6 milligrams for the uric acid. Better is less than 5. And it's important to realize that some people can't get to those levels simply by taking the allopurinol, even at a higher dose, and those people might have to take an extra drug, and the extra drug would be something called a uricosuric. A uricosuric would be a drug like probenecid. The allopurinol stops the uric acid from being made. The uricosuric makes the uric acid that's in the system go through the kidney, and it's urinated out much faster and in higher quantities. Well, if a person begins the therapy with the allopurinol or the Zyloprim for several months, remember it's important to take something to prevent a flare, whether it's a naproxen at a small dose or a Aleve or Indocin. Those are all appropriate, and it's important to make certain that you're taking enough quantity of liquid. Now, there are warnings and precautions to taking the drug. Warnings principally is development of a rash. That's a sign of an allergic reaction oftentimes, and sometimes that mild skin rash can progress to hives, exfoliation of the skin, bleeding into the skin, sloughing of the skin, and it might be associated with irreversible damage to the internal organs, hepatotoxicity, liver damage. So as a result, people need to have appropriate screenings, both of the blood, and if a rash forms, then you certainly must bring that to the attention of the doctor, and especially if you happen to have a rash and you're taking the drug and you're also suffering from some reduction in your kidney function and you're taking a diuretic, a water pill. Now, it's important that people who are taking Imuran or azathioprine, same drug, just different name, well, if you're taking the drug, maybe for rheumatoid arthritis, the dose of the drug, the dose of the azathioprine has to be reduced by about 80%, 80%, because it's going to build up in the system. Have to caution in people who have any kind of kidney disease while they're taking allopurinol, because that might increase the risk of toxicity. We know that the drug in some people can depress the bone marrow. It can depress the bone marrow anywhere from 6 weeks after you start to 6 years after you start the therapy. So we need periodic blood tests. Well, if a person begins taking the drug, one of the side effects is you might have more gouty attacks. Another one is you might develop the rash that we talked about that can occur anywhere between 1 and 10% of the people. Well, the rash might just be a rash, so there's no need to panic, at least at the start. But if the rash is associated with fever and chills and joint pain and maybe yellowing of the skin, jaundice, start itching, then you better see the doctor immediately, because it can potentially be life-threatening. We also know that it seems that some people are especially prone to those very severe rashes and internal kind of problems. And those people tend to be the Han Chinese or the Thai. They have about a 1 in 12 person incidence of this kind of severe reaction, as opposed to, say, Europeans, where it would be 1 in 100. Well, the likelihood, if you have an abnormality of it's known as the HLA-B 5801, that can be tested in a routine laboratory test. Well, if you are positive for that, then you have anywhere between a 40 and a 600-fold increase in the risk of toxicity. The FDA doesn't make any comment as to whether people should be tested, but the American College of Rheumatology says, hey, anybody who's potentially at risk, especially Asian, especially the Han Chinese or the Thai, then they should get this test. And if a person tests positive, then this just is not the drug for them. The drug can have interactions with a variety of other substances, the azathioprine or Imuran I mentioned, and warfarin or ampicillin or amoxicillin or the water pills or dilantin or ACE inhibitors, and certain kind of medicines that are used for treatment of diabetes. We know that once you take allopurinol, it's going to be converted in the system within about 2 hours into the active drug. The allopurinol doesn't really do all that much. It's the oxypurinol, which is a metabolic conversion product of the allopurinol, that actually does the work. Well, if we look at the absorption, it seems to be pretty complete within about 30 to 60 minutes. The bioavailability is going to be somewhere around 90%. If we look at the oxypurinol, which is really what we're interested in, the half-life is somewhere between about 12 hours and 36 hours. And as a result, most people can get by taking the pill just once a day. Now, the allopurinol and the oxypurinol are both going to be cleared by the kidney. The way they work is they inhibit the action of an enzyme known as xanthine oxidase. Xanthine oxidase takes hypoxanthine, converts it into xanthine, and then converts the xanthine into uric acid. So if we take the allopurinol, it's going to prohibit all of that. Well, that's what we call the purine pathway. That's very important in the production of nucleic acids. However, the body just reuses the hypoxanthine and the xanthine, so there's no problem preventing that enzyme from working. Now, information for a patient that's very important. If you have a rash or a problem, you immediately call the doctor. Some people develop painful urination or blood in the urine or eye swelling or swelling of the lips. Hey, talk to the doctor right away. It seems that you need to take a lot of fluid. So if you're taking allopurinol, if you have the gout, you better take an awful lot of liquid. We also know that you have to be extraordinarily careful if you're taking other kind of medicines, the ampicillin, amoxicillin, the diuretics, or warfarin. If you forget a pill, don't double up. Don't take 2 pills at once, because the pill may cause drowsiness. Well, when you start taking it, you should be aware and not do anything that might involve operating heavy machinery. Don't drive when you start taking the pill. See how it's going to affect you. And if you want to reduce the likelihood of stomach irritation, take the pill with food. Now, the good news about allopurinol, as opposed to some of the other drugs that we use, is this drug is relatively cheap. Actually, if you just paid cash, a month's supply would cost only max $30. If you have a coupon, say, from GoodRx, it might be only $10. On the other hand, if you took the Zyloprim, that's the brand name of the allopurinol, that would cost $130. Now, another competitor, a competitor that increases rather than decreases the risk of cardiovascular death, well, that drug is available 40, 80 milligrams, called Uric. And Uric has a price, because it's only available as name brand, no generic, of about $400 a month. So, no question, if you have gout, and if you have symptomatic gout, and if you have enough recurrences, 2 or more attacks per year, then this is something that you should consider. But remember, just because you're taking the drug doesn't mean you're not going to have an attack of gout. But it may well prevent damage to the kidney and damage to the joint. But unfortunately, it comes at a cost. The cost is it has a relatively high rate of side effects. So if you're taking the drug, just be careful, be cautious. And anyway, thanks for watching. I'm Dr. Ken Landau.